going to be willing to pay the price?
I just want to quickly speak to that question. I think part of what that question seems to indicate is that one or the other is necessarily better, whether we got to this discussion because of the budget or because we care about the people. I don't necessarily believe that. We're in the discussion, and the shape of this discussion is not necessarily dictated by how we got here, but it's dictated by whose voice is prevalent. I mean, if you watch what happened during the summer, part of the reason we got into the death panels and some of the more crazy conversations we've had is because of who was in the room, the people who were speaking on talk radio, and all of the things we know that have shifted the conversation. We need to be in the conversation to shift it in the direction we want to go to. So whether we got here because of budget, which I believe is probably the reason. I mean, we've had healthcare as an issue for many years, as was said earlier, but now we're actually taking a serious look at it. Whether we got here because of the budget or because the people need better healthcare is something I guess we could talk about academically, but I don't think it's that important. What's more important is how we shift this conversation.
And I guess that I would say it's a great question. The president says something must be done because of the escalating costs in Medicare costs, which is another one that you can go back and read the literature every year of what they said it would cost and what it costs. I think the answer is both. I think it is both. I think it is both dollar-based and to some lesser degree the wellness of the population. If it was only about the wellness of the American people, then we would only be focused on those 40-something million that don't have insurance. And we would be not focused on the 65 to 68% of the people that say they're quite happy with the current insurance levels that they have. Every study that's done says 63, 65% of the American population is quite happy with what they have. So if we were really only altruistic, we would only be turning our attention on the people that don't have the financial means to get the coverage they need, and we would leave the others alone. So I think the answer is both. It's both dollars and it is both also on the wellness of the population.
One other comment. A lot of the and it was raised initially starting with the panelists, a lot of the money that we're spending in healthcare today is going outside of the healthcare system. It's not targeted in just actually delivering care. And some of that has come with the evolution. You know, there used to be a lot of trust of the family doctor, and then the relationship between the doctor and the patient changed with insurance. Patients got used to, well, we can go see the doctor, we only pay a little piece of the pie, and then the doctor bills the insurer and all the rest of that. Well, then the insurer starts saying, we don't know if we trust the doctors are doing the right care. And in Florida alone, just for cancer, there's a company that's been hired by Blue Cross Blue Shield to manage what the doctors are doing for treating cancer. They're promising Blue Cross that they can save them $71 million by changing the drugs the doctors use, telling doctors they can't use certain drugs for certain things. But it's going to cost Blue Cross $17 million to pay this company to manage the doctors. Now, I think what it really comes down to is what they're doing is they're saying, okay, instead of paying $5, we're going to pay $4, so that's part of the $71 million. And patient X, you're not going to be able to get that drug. There are certain drugs that are identified for moderately or highly emetogenic patients, and the goal is to keep people from getting sick, from getting nauseous up front. And one of the policies that's put in place to save the $71 million is you're going to have to fail an oral version of this drug before you get the drug that we already know is going to keep you from getting sick. And so there are various policies that go in like that. So I think one of the things that people need to really ask in healthcare reform is where's the money really going? A huge piece of the savings that are budgeted for how you're going to pay for this is in disease management. Disease management in our world, in the physician world, means hiring somebody to tell the doctors whether they're doing is right or not. And invariably, those people are not the doctors, and they're not doctors. They may be actuaries. They may be looking at analytics. So I think that's a really big part to ask. Do we really want to start to build a bureaucracy that's trying to manage healthcare, or do we want to get back to the simplicity of those that provide the care and those that need the care, and making sure we're finding ways to just keep the money flowing?
I was wondering when they created the bill that they looked at Europe, because the euro is doing much better than the United States dollar. And all of Europe is covered. You know, all the citizens, Canada, there's other countries, Australia, that have universal health care. So I don't really hear any negative things about Europe. I know at least England, you know.
Hi, Doc, good to see you. When you've seen one in Europe, you've pretty much seen one. You know, I have a bunch of, Representative Larson says he believes what will come out will be more like the Swedish bill. There are other people that believe what will come out will be more like the Canadian bill. There are some people that it'll be somewhat like the England. So I don't know that, again, I hate to sound